We are still continuing with the introduction to foundation of midwifery, and now we want to look at the scopes of practice. So when we talk about the scopes of practice, it defines the activities a healthcare professional is legally permitted to perform based on their education, training, and experience. So that means we want to know exactly what the midwife is supposed to do and what uh, they're supposed to do based on their training and education and experience also. So one of the scopes of practice that a midwife should do is to know the legal boundaries of midwifery practice. So the legal boundaries of midwifery practice keeps someone to make that to produce best quality care or to give best quality care to their clients, to the mother and the baby, and also to make sure that they are following ethical codes of conduct. So the scope of practice will help that person or the midwives to know the legal boundaries of midwifery practice. So simply, you should know what you are supposed to do and what you're not supposed to do. Then collaborating with other healthcare professionals within the scope of practice. So as a midwife, you should know the other healthcare professionals you are supposed to deal with, especially if there are complications that you cannot handle alone. We also have examples of healthcare professionals that you can collaborate with, like the obstetricians, others like pediatricians, others even physicians, depending on the medical condition that the mother is faced with. We also have one of the scopes of practice that is avoiding unauthorized procedures or interventions. So there are some procedures which are unnecessarily done these days in the hospital. And as a midwife, if you find that a mother can actually undergo through a normal delivery without those medical interventions, that is part of your scope of practice to make sure that you avoid those unauthorized procedures or interventions. Because we know we work where we are multidisciplinary teams, and sometimes you might have a colleague who wants to do some procedure which exceeds the scopes of practice. So now we go to the midwifery regulations and licensure. Midwifery is a regulated profession in many countries to ensure quality and safety. So just like any profession, there are regulatory bodies as one of the qualities of a good profession. There should be regulatory bodies. So midwifery is regulated also in many countries. So the reason for regulating the quality of care or for regulating the practice is to make sure that whatever service that you're giving is actually quality and safe. Then regulatory bodies set boundaries of practice, establish educational requirements, and issue license to qualified midwives. So the same regulatory bodies are the ones who make sure that the standard of practice is maintained and is up to quality. They also make sure that they establish educational requirements. That means there is some requirements which is supposed to be met because before somebody joins the midwifery program, and also issues license to qualified midwives. So it's only after when you have finished school and you have qualified to be called a midwife, that's when the license is given to you so that you're able to practice. The next is licensure helps protect the public and ensures midwives adheres to professional standards and ethical guidelines. So this same license, which is going to be given to you so that you are able to practice, it helps to protect the public or protect you from the public. At one point, there might be some medical errors, and from the medical errors, the public might take issues legally. So the license will help you or protects you from the public. And also, the same license will ensure that you adhere to professional standards and guidelines. That means you cannot act beyond what the guidelines is telling you. Midwifery regulations and licensure in South Sudan, just like we mentioned earlier on, we said uh, there, the midwifery profession is regulated in many countries. So it is the same with South Sudan, that the nurses and midwives bill is yet to be signed by the parliament, and thus an interim nurses and midwives council will be formed. So that means currently we are actually not having regulatory bodies uh, that is providing license in South Sudan, but we have midwives registered South Sudan Nurses and Midwives Association, which is called SANAMA. So what we do these days is, after when you have qualified, you are supposed to register with the South Sudan Nurses and Midwives Association, which we call SANAMA, as we wait for NAMCOS to be approved. Then we go to professional competence. When we talk about professional competence, we need to know how we maintain up-to-date knowledge and skills. So by maintaining up-to-date knowledge and skills, you are helping yourself to maintain also your professional competence. So you can do that by attending, participating in continue education, or what we call CME. If you're practicing in a big hospital, there are always those educations which are conducted within the hospital setting. Apart from that, there are also other educations which are conducted maybe by NGOs in other settings. So those educations which are given, it helps you to keep the knowledge and the skills up to date, so that you provide quality service to the mother and their family. Then adhering to evidence-based guidelines and best practice. So one of the professional competencies, as a midwife, you are supposed to be able to adhere to the evidence-based guidelines. That means whatever the research has come up with, and it has been declared that something new has been approved for the midwives or the health profession to adapt, you should be able to adapt to the evidence-based guideline and best of practice. Midwifery and professional development. Midwives are committed to lifelong learning and professional development. So you find that in most cases, midwives, they are committed to lifelong learning. That means each and every time you are going to have continuous education, things which are going to be improved, so that the quality of care that you're giving is up to standard. They engage in continuing education program, attend conference, and participate in workshops to enhance their knowledge. So that is how you develop professionally. Professional developments enable midwives to stay up to date with the latest evidence and advancement in the field, ensuring high quality care for women and their family. I can give an example of the latest pantograph which has been brought in by WHO. So it is the same WHO that is changing the pantograph, and it is the same WHO that produced the old pantograph. So that means for you to maintain your professional development, you are supposed to be able to attend conference, participate in workshops, so that you keep your knowledge up to date. Midwifery and the role of technology. So as we see, technology has actually improved health sectors, let me say. Like, it has assisted in providing quality care when it comes to health sectors. For example, we are having electronic health records, we are having telehealth, we are having mobile applications, and other technological advancements which are used in midwifery practice. Let's say, because of technology, we are able to do DNA even when the fetus is still in the mother's womb. So if we had no technology, you find that playing that part of midwifery role would be so hard. Midwives embrace technology as a tool to enhance communication, facilitate remote consultations, and improve the overall efficiency for care of provision. So all these technologies which has been brought in place is to make sure that we are having or bringing better care to the people we are serving, especially the mothers and their family. Midwifery and the global maternal health agenda. So when we look at maternal health agenda specifically, we look at the sustainable development goals. So midwives are integral to achieving the global maternal health agenda, including that of sustainable development goals 5. So they reduce maternal mortality, improve access to quality care, and promote reproductive rights. So that is how midwives help to improve or achieve global maternal health agenda. Apart from that, their expertise and commitments are crucial in achieving equitable and sustainable maternal health outcomes worldwide. So being an expertise midwife or being a specialized person will make you committed, and that makes you ensure that whatever service that you're giving are provided equally among the people you are attending to. So that would be all for now. And if there is any question, you can always send it on inbox. Thank you.